Right. Good morning. My name is Paul Emerson, and I am the chair of the Hospital Board's Redevelopment and Properties Committee. Before we start, it's my honor to give the land acknowledgement. The Brant Community Healthcare System is located on the traditional lands of the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit First Nation, and today is home to many Indigenous people. This land is governed by the Dish with One Spoon Covenant between the Haudenosaunee Confederacy and the Confederacy of the Ojibwe and Allied Nations. The covenant is an agreement to share, work, and protect this land together in harmony. So as an organization, we at the Brant Community Healthcare System are committed to working together with Indigenous peoples to address health inequities and create a care environment that is free from discrimination and racism against Indigenous patients, families, or staff. We are committed to creating a culturally safe environment, valuing Indigenous healing practices and medicines, promoting cultural competency, and creating opportunities for Indigenous health practitioners. So it's my honor and opportunity today to formally welcome Ontario's Minister of Health, Sylvia Jones. We've been fortunate the minister was here one other time and we did a tour and she came back, so I'm very pleased with that. We are also pleased to welcome MPP Will Bouma. There are some mayors and councillors present. I know that there's Mayor David Bailey with the County of Brant. There's Rose Sokola representing the City of Brantford. We have Jesse Heckamer. Where's Jesse? Oh, there you are. Great. From the Mississaugas of the Credit. We have a few board members from the Foundation and the Brant Community Healthcare System board, and we also have senior leadership and senior medical leadership members here. I won't introduce you all. I don't know everybody, but it's a lot to introduce. It's an important day here for the board and for the future of our hospital system. Minister Jones will soon speak to the specifics, but I'm pleased we're here today in the interest of advancing our goal of building a new hospital for the communities we serve and advancing the BCHS vision of leading beyond care. So much of what we do daily here at the BCHS is driven by incredible people, individuals working collectively to ensure that the needs of our patients and the community are met with professionalism, pride, and empathy. With the funding today, the BCHS, its board, the foundation, and thousands that work in the hospital system are now able to work with the community and to begin planning for what's next in our common efforts to provide great care. On behalf of the Board of Directors of the BCHS, I would like to thank Minister Jones, MPP Bouma, and the Province of Ontario for their ongoing support to this hospital system. And with that, Minister, I'd like to welcome you to the podium.
Thanks, Paul, and good morning, everyone. It is indeed great to be back here in Brantford alongside your local MPP, Will Bouma. I cannot tell you how many times Will has given me an update on your hospital. But you know, that's what advocates do. And the fact that he is so engaged in this community, in investing in this hospital, really speaks to his commitment to your community. So thank you, Will. You know, I see the work that he has been doing, ensuring that there is better access for primary care. And I believe that later today, he will be sharing even more good news for your community. Thank you again to Bonnie and the entire team from Brant Community Healthcare System for hosting us today and for everything you do to provide exceptional care to patients and families in this community every single day. You know, working with my team, I see Parliamentary Assistant Anthony Liardi is here, so great to have you here. And under the leadership of Premier Ford, our government has been making historic investments into protecting Ontario's healthcare system. And we are taking bold and innovative action to make it easier for patients and families to connect to care close to home. We continue to build capacity across our healthcare system, significantly expanding access to primary care, growing and supporting our healthcare workforce, and making critical investments to expand and modernize our hospitals and build healthcare infrastructure, which of course is why we are here today. Over the next 10 years, we are investing nearly $60 billion in major health infrastructure to get shovels in the ground on more than 50 major hospital projects across Ontario and add approximately 3,000 new hospital beds to build a connected, people-first healthcare system. As you will no doubt know, last year our government invested nearly $16 million to complete critical upgrades and repairs to Brantford General Hospital's utility tunnel and boiler system. As part of our investment in infrastructure upgrades, maintenance, and repairs at hospitals and community healthcare facilities across Ontario. And today, I am pleased to announce that our government is continuing to build on that progress. We are connecting more people in Brantford, the County of Brant, and the surrounding communities to the high-quality hospital care they need by investing an additional $12.5 million towards the expansion of the Brant Community Healthcare System. Congratulations. This investment will build on our previous funding of $2.5 million, which will advance the planning to build a new state-of-the-art hospital in Brantford. Once opened, patients and their families can expect to receive more access to core programs, emergency services, and intensive care, medical imaging, and other diagnostic services, new ambulatory care programs, and clinics to increase access to life-saving dialysis and cancer care. This will connect people to care sooner and will ensure the hospital can continue to meet the needs of the rapidly growing region. This investment is another important step we are taking to ensure that people and their families in your community can connect to the care they need, where and when they need it, for generations to come. Thank you again to the entire team at Brant Community Healthcare System and all the healthcare workers across the County of Brant and surrounding communities for the incredible care and support you provide patients and their families. It's now my pleasure to invite MPP Boma to share a few words. Stay well.
Good morning, everyone. Minister Jones, thank you for coming to our community. It's always great to have you here in Brantford, Brant, and you always bring good news to our community. And despite how I do call the minister or send her a text on a very regular basis, but she always returns my calls, and it's usually within an hour, and thank you for that. Paul, we've been friends for a very, very long time. And I enjoy the fact that we can have a frank, straightforward discussion, direct conversations about what our community needs and how we can accomplish that goal together. So thank you for your work and continued work with the board. Minister, thank you for coming here to announce the rest of the planning grant, which should complete a critical phase and help take a step towards a new hospital. You, Minister, continue to put up with me, and for that I am very, very thankful. But you also understand, and I remember when you took the tour not that long ago also, you could see for yourself the pressing needs of the Brant Community Healthcare System. One thing that I have always known is that this community comes to work together as a team to make great things happen. And I'd like to recognize also the hard work of the Brant Community Healthcare System, the Board of Directors, the CEO, Bonnie Cam, for your diligence, cooperation, and flexibility on this project that carries so much of our future. And so thank you. Thank you for working with my office to move the project to where we are today. It was the community that came together, and when we work in unison, so many incredible things are possible. But this is kind of just the actual end to the beginning. And so the heavy lifting still needs to happen. And I look forward to seeing the next steps here in Brantford, Brant. Our government has demonstrated that public health care is one of our top priorities. And under the leadership of Premier Doug Ford and Minister Sylvia Jones, Ontario is building new hospitals throughout the province, as the Minister mentioned. It is investing in eventually connecting everyone in the publicly funded family doctor and a primary care team. And in a few hours, Parliamentary Assistant Anthony Liardi and I will be making another good news announcement here in Brantford, and so stay tuned for that good news. And I would also like to say thank you to our partners in the region. The City of Brantford, the County of Brant, the Six Nations of the Grand River, and Mississaugas of the Credit, as well as private donations to the BCHS Foundation, who have committed to helping make this project an overwhelming success. And just before I call on Bonnie to say a few words, I have a little gift. Because we've been working together so long, and this is something that we waited for. And so this one is for Bonnie. This is a copy of our budget, the Plan to Protect Ontario, signed by the Premier. Bonnie, thank you for all of your great work. Doug Ford. And for Paul, this is Bonnie and the BCHS team. Thank you for your partnership and work in protecting Ontario patients. Peter Bethlen-Falvey, the Minister of Finance for the province of Ontario. Thank you very much. And so now I'd like to turn it over to Bonnie Camp to say a few words. And Bonnie, thank you.
Wonderful. Thank you.
Good morning. Thank you, MPP Bauma, and good morning, MP Dan Nyes, MPP Will Boma, our County of Brant Mayor David Bailey, the City of Brantford Councillor Rose Sokoli, our Councillor for Mississauga of the Credits First Nations, Jesse Herkmeyer, along with our board members, our senior leaders, our guests here, and of course our Deputy Premier and Minister of Health, Sylvia Jones. Today is a foundational day for all of us here at Brant Community Healthcare System. This $12.5 million of funding for Phase 1.3 of our new hospital planning process puts BCHS on a solid footing for the future of healthcare in our community. In particular, this funding helps BCHS in the functional planning phase, a critical phase in our collective efforts in what the size of the new hospital will be, its location, and the full scope of services. It allows us to look into the future, not just for the next few years, but for the next several decades. Clearly, the communities we serve are growing, and so are the demands on our healthcare system. The need is great for more patient beds, more advanced technologies, and more room for expansion. BCHS recently launched its strategic plan 2025 to 2023, and the vision for BCHS is leading beyond care. We envision our health system and our hospital as the anchor institution for the community and the entity that ties together quality and patient care, whether it's within our four walls or beyond. Certainly, as we proceed through this next planning phase, that vision will start to quickly take shape and come to life as the conversations we will be having, the consultation sessions we'll be holding, and the tangible plans that we will present over the next year. Out of that will come a very clear blueprint for future healthcare in Brant, Brantford, Six Nations, and Mississauga of the Credit. As part of the provincial budget announcement in May this year, there was also mention of Greenfield, and I know that has resulted in significant interest in our community. And I want to thank the Ministry of Health for that latitude in our planning process. And to the community, I want to be very clear that we are keeping all options open. This next phase is an opportunity to cast the net wide on potential locations before we start the path of detailed design of a greenfield or adaptive reuse site. What everyone should understand is that choosing of a new site will be an open, collaborative, and transparent process. We will work with the ministry, our board, foundation, our Indigenous elected councils and municipal councils and our community to arrive at a solution that is the best for exemplary patient care now and well into the future. I do want to take a moment to thank once again Deputy Premier Jones for not only the ministry's constant support for our infrastructure challenges, but for championing our growth plans at the Cabinet table time and again. Thank you, Deputy Premier. I would also like to specifically thank MPP Will Bauma, who consistently advocates the need for more healthcare investments in Brantford, Brant, Six Nations, and Mississauga the Credits region. We are truly fortunate to have an effective voice in Will, and I know he will be right beside us as we move forward with the next critical planning phase. Thank you, Will. Finally, to our guests, our supporters, and our community, I look forward to and ask for your full participation over the next year as we plan for our collective health future. Our new hospital can only be successful if it is reflective of those whom it serves. And I look forward to hearing new ideas and welcoming greater participation as part of this next phase. Together, we will build a better BCHS, reimagine our future, and I'm so excited that we are fully on our way. Thank you all very much again. I will now turn it over, I believe, to media Q&A. Thank you.
We will now begin to take questions from the media. All media present can line up behind me at the microphone. And as a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question. Thank you.
Good morning. Good morning. Vincent Ball, the Brantford Expositor. How are you?
Great.
Something's changed. Just over a year ago, the healthcare system officials were at City Council and had said that all the planning should be on the existing site, and that appeals to build on a greenfield site had been turned down by previous ministers. I'm wondering if you can tell me what's changed.
Well, what's changed is a reality of making sure that the local community, the hospital leadership, actually have input on that. And as Bonnie rightfully pointed out, all options are on the table. We didn't want to take away a pathway if that's what the community and the hospital leadership felt they needed for this new facility.
As a follow-up question, I think you mentioned the figure $60 billion being invested in new hospitals over the next several years. You would have a good handle as to the state of repair and the needs throughout the province. Where does Brantford sit in terms of all the needs in the province? Are we number one out of 10, or are we number 5? Where are we?
Well, Will would say you're always number one. What I can tell you is some of the work that the ministry does is to track state of repair for hospitals, but it's also to track where the growth is and where the needs are continuing. And that work all couples together with, frankly, hospital leadership, board leadership that come forward with proposals and ideas. So is there any doubt that we have some challenges here on the maintenance and repair? Absolutely. But as Bonnie and Will highlighted, we also have a growing community. So both of those coupled together is exactly why we were able to ensure that this project came forward in our budget in the spring, and of course why we're here today to highlight the next stage of the planning. Thank you.
Hello, Celeste Percy-Beauregard from the Hamilton Spectator. Where we're at this stage, what's a realistic timeline for the new hospital? How many years do you think it could be before we open the doors?
Great question. So as with all major capital bills, now the work of the continuation of the planning, the input from community will continue. And then as those plans come forward, Bonnie and her team and the board will be working with the Ministry of Health on design pieces, as well as Infrastructure Ontario. I don't want to presuppose, because there are multiple stages that happen in terms of request for proposals, the bidding process, and ultimately the design and the building stage. So I think it's frankly a little early to start pegging years.
Thank you.
Thank you. That concludes our media availability. Thank you, everyone, for attending.